Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. In this segment, we're going to be speaking with returning guest Dr. Kendra Grubb. She's joining us here from Emory University in Atlanta to talk about the midterm results from the main cohort of the Optimize Pro clinical study, which was presented at EuroPCR 2022. Welcome back, Dr. Grubb. Thank you for returning.
Oh, Neil, thank you for having me this morning.
Well, for our listeners who may not be familiar with you as a contributor to our channel, give us a brief look into your professional background and talk about your role at Emory University briefly.
Well, I'm an adult cardiac surgeon, and I specialize in structural heart disease. And so structural heart disease is all of the parts of the heart kind of on the inside, all of the valves and the muscle. Although as an adult cardiac surgeon, I also work on coronary arteries and do bypasses. My primary focus is as the surgical director of the Structural Heart and Valve Center for Emory University.
Give us a brief overview of the Optimize Pro clinical study that I mentioned in our opening.
Well, Optimize Pro is a study that was looking at ways to improve outcomes for patients. Now, Medtronic had studied the Evolut valve in the various generations previously, and the most recent trial that they had done, the most recent randomized controlled trial, was for low-risk patients, and the results were excellent. However, even with those great results and FDA approval for their TAVR valve for low-risk patients, there were still ways to make it better. Two of the problems with the Evolut platform from that trial was that the pacemaker rates were higher than some of the other valves on the market, and the regurgitation, so leakage around the valve, was higher than for the surgical valve. And so those two things were really areas that could be improved upon as we get into younger and low-risk patients who have a longer lifetime to live. Now, from our previous conversation, we kind of talked about transcatheter aortic valve replacement, or TAVR, initially being designed for elderly patients. And so pacemakers and a little bit of leak around the valve, those things were more tolerated. But as we get into younger and lower risk patients, we really need an almost perfect result, because these patients could have open heart surgery, and for surgery, their results would be excellent. And so what you're really looking for is in Optimize Pro is how do we make it better? And so using pre and post patient care pathways, as well as deploying the valve in a new technique called cusp overlap, we were able to achieve results that we'd never really been able to see before, with single-digit pacemaker rates and elimination of the leakage around the valve to the point that no patient had even moderate paravalvular leak. And so this was pretty profound.
What was it that was causing the leaks in the first place? Was it just the introduction of younger patients that prompted ways to make it better?
Well, it was the younger patients that prompted optimization. We just needed to be better at giving our patients the best result we could possibly give them. In regards to your question about what was causing the paravalvular leak, the Evolut platform by Medtronic is a self-expanding valve, and so it's made of a memory metal. And then there's a wrap around the outside that's supposed to create a nice seal. In open heart surgery, like I do when I go to the operating room, when I have my open heart surgeon hat on, I cut out the patient's valve leaflets and sew a new valve in, removing all of the calcification, all of the old valve tissue. Well, for TAVR, we leave that valve in place. And so when I'm doing my TAVR valves with my interventional cardiology colleagues, now, this is a puncture in the groin, a wire up into the heart, and the valve goes in on a long delivery system. And the valve is made of the memory metal. And so as soon as it hits the warm blood, it starts to open on its own. Mm-hmm. And because we haven't removed that old valve with all of the irregular calcium, there's all these little nooks and crannies, we rely on the memory metal to stretch open, and then there's a skirt on the outside to help make a seal. But it's not a perfect seal. And so oftentimes, especially if the valve is implanted a little bit low, there'll be leakage between the patient's native valve and this new implant. Well, with Optimize Pro, we really focused on precision and control, being able to deploy the valve exactly where we wanted it. And we found that with a 3 millimeter depth of implant instead of 6 or more, we were able to achieve that. We put the valve exactly where it was supposed to be, consistently using this new technique called cusp overlap. Mm-hmm. And then we're able to really decrease our pacemaker rate as well as the paravalvular leak rate. And the important part was that we also were able to get the patients home faster. So it used to be that the stay in the hospital was 3 or 4 days. Our median length of stay for Optimize Pro is down to just 1 day. Literally, the patients come in on a Monday, they get their valve, and they go home Tuesday morning. And so that was really, really another optimization. And part of that was because we were getting such a good result. Mm-hmm. So it all kind of plays together. Now, this first data, this interim analysis that I presented, is the first 400 patients that had this technique. And each site did 3 roll-ins where they were proctored. And we actually have found that when the proctor was there, when they were really following the steps, the results were even better. And so when we looked at the data from Optimize Pro and we looked at all of the steps that the team had captured, if the steps are followed, the results are even better. And so I think that, the study just tells us that we can get excellent results, with a median length of stay of 1 day, low mortality, less than 1%, no patients with moderate or severe paravalvular leak, and the majority of patients with none or trace. 80% almost had none or trace. And so this was just a change in technique. They didn't change anything about the valve or the platform. That's coming with their next generation. But we were really able to get excellent results for our patients, which is always what we're striving for.
Is there anything that you'd like to add? I mean, maybe another surprising yet beneficial aspect of the test for our listeners. And then would you give us a couple of web addresses where our listeners can learn more?
Sure. Well, I think that, a couple of things about this trial that need to be mentioned. This is just an interim analysis. And so the full trial will have 650 patients. The rest of the patients will come from Europe, the Middle East, and Australia. And so the enrollment is ongoing. So it's entirely possible that the results that I presented, they'll get even better as we're becoming more familiar with this technique. In the United States, it was often a new technique for these sites, whereas now that we've rolled it out to other parts of the world, they've been using this technique for a couple of years. So I would be surprised if we didn't see the results get even better as we finish the entire trial. And the patients will be followed for a year. And so probably by 2024, we'll have all the data and be able to say, yes, this is really the way to do it. In terms of websites, the trial itself is called Optimize Pro. You can find more information on clinicaltrials.gov. And then also Medtronic and the Evolut platform. I would refer you to medtronic.com. And that's a place where you can find out more about the Evolut valve platform, about the trials available, and the therapy. There's also some really nice discussion and some images so the listeners can find even more information about how the valve is deployed, what the risks and benefits are. But in terms of the Optimize Pro trial, the best data that we've seen, and we're really encouraged as we get further along into younger and low risk patients that we're going to be able to give them a surgical-like result without the downtime of surgery.
Kendra, always a pleasure, always informative, some great information. Thank you so much for returning. I'm looking forward to our next conversation. Thank you so much.
Oh, thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. Kendra Grubb. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.